Return on investment for any healthcare practice, really there's probably several very tangible return on investment parameters that are typically evaluated, and there are probably several intangible. So when we discuss return on investment with the laser therapy, we generally discuss the more tangible avenues, but the less tangible ones, the ones that we have a harder time quantifying, really include things like additional new patient referrals. And for many practices, an additional new patient referral, even if they're being referred specifically for laser therapy, would include potential revenue opportunities outside of laser therapy, because a new patient is a new patient, and each practice calculates the value of a new patient differently. Return on investment for some practices with laser therapy really has to do more with what are the FTE requirements for the alternative to laser therapy, whether that is a surgical FTE requirement. If a doctor is performing an Achilles tendonitis surgery, for example, that doctor is not seeing patients for some large chunk of that day. And so whatever the reimbursable event is for that surgery, if that surgery didn't take place because that patients were being treated with MLS laser therapy instead, what would the doctor's billable time be like during that same day, if you will? So those are less tangible things that we have a hard time calculating. From a tangible perspective, it's pretty simple. The vast majority of MLS users finance the equipment, which makes it easy from a cash flow perspective. And really, whether they select our robotic device or our semi-unattended device, as we call it, any of these devices require, with typical billing, somewhere in the neighborhood of 2 to 3 patients per month to select the therapy in order to just simply pay to have the therapy available in the office. Anything beyond that becomes and can become a very significant revenue stream.